Good morning. I'm Vash. I'm one of the lead research nurses.
A vaccine is the most likely ticket back to normal life, and at the Royal Free Hospital in London, they've started final stage trials of a prototype made by the biotech company Novavax. Patient 93 is the woman in charge of buying COVID vaccines for the UK stockpile, one of the 270,000 British people to have volunteered for trials.
It's really important that we check the long-term safety of these vaccines. So I'll be coming back for a year after the second dose. For routine visits, it matters that we understand how the vaccines actually perform over the long term, because we need to be sure that these are safe.
Thanks for participating and volunteering.
But will it be effective? The chief scientist is optimistic.
It's possible that some vaccine could be available before the end of the year in small amounts for certain groups.
But on Monday, the Prime Minister was more cautious.
I don't wish to depress him, but we must be realistic about this. There's a good chance of a vaccine, but it cannot be taken for granted.
Even the vaccines chief warned we may just have to accept the first prototypes won't stop the virus.
A partially effective vaccine is better than no vaccine at all. So a partially effective vaccine will at least help those people for whom it is effective.
The UK has spread its bets with 6 vaccines in the stockpile. The current leader is made by Oxford University and AstraZeneca. Results from final stage phase 3 studies are due any day on whether it protects against the disease. But a US trial is on hold while authorities investigate a possible adverse reaction. Close behind is BioNTech and Pfizer's vaccine, with key phase 3 results due imminently. Johnson & Johnson's vaccine is also in phase 3 clinical trials, but they've been paused while a possible adverse reaction is investigated. Novavax has just started phase 3 trials, including one of 10,000 people here in the UK. 2 others are in early stage trials. Other scientists are also cautious. Immunity wanes rapidly after COVID infection. If the same happens with the vaccine, it may only protect for a month or 2.
And for elderly people, this is a serious illness, and therefore, if we can give hope to those people, then I think it's important. But of course, it can't be false hope. We have to be reassured that those vaccines do what we intend.
It takes a while for scientists to work out the Achilles heel of a new virus, and while the prototypes currently in clinical trials are a sign of good progress, they may not be enough to bring the pandemic to an end. Thomas Moore, Sky News.